So let's lay flat on your back, facing up. Let's get you checked. Want to make sure you're comfortable on here too, so slide down maybe just a little bit more. And that's beautiful. I'm gonna pull this out. Got it. He's got long legs here, so need a little extra support. So what I'm gonna do is just check his pelvis, check his legs. Definitely a little off. Greg, can you feel how there's a little bit more tension in that left leg?
Yes.
This right leg is pretty floppy. This left leg is not so much. So before I actually adjust, I want to loosen him up. The most important part of this adjustment is getting the cranial-cervical junction lined up. But before I do that, I actually like to loosen up the muscles of the legs, the pelvis, where there's any tight spots. Help release some of that tension even before we get to moving the spine. How does that feel in the lower back?
Good.
No pain, right?
Go to sleep.
We don't want you to go to sleep. Greg shared with me, he was on Flippin' Vegas, Flippin' Homes, and he used to be nicknamed the Talent. Maybe too talented, he got his back into trouble. He's actually got some little kiddos at home, a 100-pound kid that he likes to walk. How many every day?
He goes to park every day.
Park every day. His kid actually has 4 legs, so can imagine that.
Clear. Yeah.
Great. Good sense of humor. That also feels good too, right? Great. Want to see if that leg loosened up. A little bit.
Feels a little looser.
I'll take that. Yeah, so let's bend your knees and put your feet flat on the table. Good job. That wasn't easy to do about a month ago. That still feel good?
Mm-hmm. A little spasming on this side.
It's like on that right here.
Yeah, right under. Finger about right on
Does that kind of feel comfortable rolling back and forth?
it. Mm-hmm.
Be honest, I don't want you to be a tough guy on camera.
It feels fine.
Good. So what I want to do is actually, let me help you sit up. So grab my arm, give me a big hug. Good job. And then swing your legs to the right. Sometimes I get my directions wrong, so I'm glad he got it right.
I had to think about it for a minute.
And stand up nice and tall. Just back down. And sit back down again. Good job. Let me just check this out. So this spot right here was kind of like spasming. Does that take some pressure off?
Mm-hmm.
So we're just trying to loosen up the paraspinal muscles in the lower back, the quadratus lumborum, for those of you super analytical professionals. The multifidi in the lower back on the left, and then coming up in through here. There's rhomboid minor on the left too. Is that a pretty good spot?
Mm-hmm.
Not too painful. Coming up across the traps and the levators. I really like to use this tool. It's called the Hypervolt. Man, I was introduced to this a few months ago, actually by some of our guests that we help, and I've seen a lot of other cool tools like the Theragun, Arthostem. I don't know why. I really like this one. Feels like I can release some of the muscles, the myofascial tension. Feel like the joints even loosen up. Try raising this left arm as high as you can. Good job. Back down. Try raising that arm again. Back down. Good job. We're not going to do the hokey pokey today. Try raising this arm up. Back down. Good job. This right one's pretty good. You right dominant?
All right. Mm-hmm.
Not too painful, right? Try slowly turning your head to the left. Like a good stretch. to the center. Try going to the left again. Good job. Back to the center. Feels good. Let's go to the right. We just check this side. Slowly going to the right. You got it. Good job. Back to the center. No tension one way or the other.
A little tension on this side, but not
Feel it.
as much better than it was.
So before I adjust his atlas, I like to get a little old school on him. Adjusting his upper back is a lot easier for me when he's standing. And I just give him a big old hug. So, you got it. Stand up nice and tall. See what this looks like. So great, we're gonna have your arms out to your side. You're gonna take a big deep breath in. And breathe out. Let your arms fall, let everything relax. Just gonna lean forward. Good job. Not too painful.
Not for me anyways, hope you're doing okay.
Oh, I'm great. Take another deep breath in. And breathe out. And let everything fall, kind of lean into me. Perfect. Beautiful. So I'm doing is I'm feeling for any joint restrictions in his lower thoracic spine. Anytime there's restrictions there, it can actually affect the lower back. And I take a big deep breath in and breathe out. I want to see how that feels standing upright. Any discomfort at all?
No, it feels much, much better.
Okay. Let's go. So this is for the upper cervical. This is for the NUCCA adjustment. Gonna get his cranial cervical junction realigned. So lay on your left side, Greg, facing that way. Got it, buddy. Lift your head up just a little bit. Go back down. And then bring this knee up a little bit. And then rotate your pelvis back. Does that feel okay there?
Mm-hmm.
Actually, Karina, if you want to come over here, I'll show you. Good. I want to show you where we're adjusting him. So come on over here. Check out. So his adjustment, he's actually got a, I think my head's bigger, but he's got a pretty good size head. And right behind the ear is actually where I'm adjusting. And I'm lining up at a specific angle based on the x-rays that we took of him about a month ago. Is that pretty comfy like that? Try to release some of this tension down in his lower neck too. There it goes. Basically just trying to feel for resistance release right around that occiput C1, C2 area. Kind of around his ear, around his upper skull. That feels awesome. Okay. So slowly, I'm gonna have you swing your legs forward facing that way, and I'll help you sit up nice and easy. Good job. Good job. Take a couple big deep breaths in. Now. Another big deep breath in. Now. I'll lift you up just a little bit more. Good job. Get your feet flat so we can Yes. It feels,
Yeah,
she feels like loosey goosey.
Mm-hmm. Well, way different than what it did.
So what we're looking for is once we get the body relaxed and the cranioscervical junction aligned, the body can just function better. So it doesn't always take the pain away immediately, but once I can feel these muscles release and know that something positive is happening to the body, at some point the pain has to subside. For Greg, it took him a few weeks. Some people notice it immediately. Others, it takes a couple months. So just kind of depends on how severe the problem is. And
I want to see mine was pretty severe.
good. Try standing up nice and tall. We're gonna take a little walk. How's this feel moving around?
Oh, good.
Looser, less tension.
Yeah, less tension. Good.
Awesome, awesome. Well, thank you guys for experiencing this adjustment with us, and look forward to seeing more.